Train arriving. Doors closing.
I wake up every minute with the fever dreams. I push my mind to a limit where it needs to be. I work blind, got vision I don't need to see. I'm picking mind over matter, I believe in me. I need to find more hours in the day to breathe. Need to find more power in the way I be. And when my mind turns sour with the painful scenes, I need to scream out loud, I can't stop me. I wanna be the greatest like Rocky. You know I leave them all hating like a hobby. I'm out here making moves like a lobby. And if you ain't with me, it's your loss, see. I got my mind on the facts, I'm a python. Grab what I like real fast, choke until I have everything I attack. Everything that I lack, everything that I want, and I see, matter of fact.
Cause I'm my own worst enemy. Only if I let it be.
Hey guys, it's me again. It's Jazz Legger, and I'm a travel nurse who likes to inspire all nurses, new, old, and aspiring, because you will be a great nurse. You are a great nurse. And if this is your first time visiting this channel, hello, welcome. And you can go ahead and click the subscribe button so we can stay in contact. You can watch my videos. The bell helps remind you, so also click that. And you can also follow me on Instagram at nurselife_jazzlegra, and we can be best friends there as well. Today's video came about because of the, if you have heard the news, the Redonda and Vanderbilt fiasco that is out there about the nurse giving the wrong dose medication to a patient and all of that. I mean, it's out there, it's in the news. Go ahead and look it up, hear about it, be about it, because what is being said about the case is that this will bring on a precedent about criminally prosecuting nurses who might make mistakes, maybe not as grievous as Redonda, but will also make it into an environment where nurses won't self-report, because self-reporting is how our system technically improves itself. So it's like, okay, cool, let's fix that so that we won't have any more human errors in that certain particular area. And nursing community is kind of worried that this will hinder that kind of environment that they have going between nurse and administration, nurse and like informatics and a pharmacy and things such as that, where they rely on finding the bugs and then trying to fix those bugs so that those bugs don't create any kind of errors, so that we can practice safely, the patients can have a safe stay and healing process. And anyway, these are 4 things that I do on shift that I know if I do these 4 things, it is to protect my license. I don't know about you, sis, but I still remember the trauma of nursing school. It's fresh. It is super fresh in my mind. So I'm gonna keep the license just for a bit longer. Yeah, I'm not is to be present with your patient. I know that sounds so simple. If you're in school, you're like, okay, cool, be present with your patient. If you're already out there, you already know the absurd amount of interruptions that happens from your fellow nurses, from the CNA, from a doctor, from the unit secretary, you name it, the patient themselves. Sometimes it's the next patient, because if you have a double room, visitors, family members, the other ancillary healthcare workers, that your PT, OT, your speech therapist, I mean, I want you to know they're coming at all fours, especially if you work days. At night, it's probably the number's cut in half, but that phone still rings. If you have like if they make you carry a Cisco or the Forcera, or if they do the whole paging thing, or if they make you wear like the what is that thing called? I don't even know what that is. It's like a little clip. It lights up outside the door. Having a brain fart, didn't remember the name. And they'll find you inside the room. And I mean, I literally have had a doctor walk inside the room and be like, hey, I'm about to talk to you about bed 2. We're in room A. No, Anyway, be present with your patient. Being present with your patient allows, one, for the patient to feel like you are paying full attention to them, you're hearing them out, you're hearing their issues. To sometimes when passing medication, say sometimes, all the times when passing medication and doing assessment, you need full focus. Just like when you're pulling out medication from the Pyxis or the Omnicell, it requires full focus. And when you get pulled in so many areas with your ears and you're thinking you're multitasking, you will go ahead and you will forget something, overlook something, or just simply not even hear the request, right? So being present eliminates mistakes. Number 2, enhance, improve, and add to your education. I know the trauma of nursing school, because when I came out, I said, don't touch me with another book. I don't want to see another book, another article. Jarvis, Potter, who else name was out there? Lipton? I don't want no name. I don't want to see their names so closely to this time that I've come out of school. That was me. But I'm sorry to say that improving yourself, adding to your education, just doing more than the continual education basics to renew your license allows you to be more knowledgeable, what gives you more arsenal in your wheelhouse so that you're able to know when something is just a little too sus, so that you can advocate and fight for something better for your patient or for your work environment. You can be like, no, we should really look at this. Or even just simply having more knowledge about the medications that you pass on the specialty floor that you might be on. You can say, I noticed because this medication says we should be assessing this, and I've noticed the patient has this. You can bring it up to the doctor, and maybe that's something they need to reevaluate about it. But nothing hurts about bringing more knowledge to you, makes you a better nurse, makes you a better practitioner of your craft. Document. It just provides legal documentation regarding the services you provide, your observations, and what you've reported, what is done to the patient, and sometimes what the patient themselves has refused. Documentation will save a life and your license. And number 4 is know your medication. That's knowing what you're giving, what the side effects are, what the assessments is that you're looking for prior to giving it, prior to giving that medication, while you're giving that medication, what to see in the medication, what are some of the common adverse reactions that could happen with that medication, or some of the side effects that you expect to see with that medication. So if that requires you to take a moment, because I want you to know right now, I am not the drug guide. I do not remember everything, but I do know the most common ones that I do give on a regular basis, so they're in my mind. But much like Epic and was it Cerner as well? Did Cerner have a spot too? But I think so. So many people have like the little like link within the med EMR space. You have Lexicom, Micromedics, things such as that, and they can run you through the gamut of what that medication does, the use, the common uses of it, the common side effects, the adverse side effects. And without a doubt, if you are something, a medication that you have never ever given ever, and you are unsure about anything, honestly, go to your charge nurse, or if you're on day shift, sometimes your nurse educator for your unit is available, so you can go use them. Or push come to shove, good old pharmacy. You know, they're all there. It's supposed to be a whole team work of a whole team. So you asking the question about a certain drip, a certain medication, a certain classification of medication towards the patient. So that is all of the ways how you can protect your license while you are on shift. Do those 4 things, and I promise you those are ways that you can protect yourself, protect your license, and ultimately also protect the patient that you're taking care of. Or patients. It's never one patient, is it? It's patients, plural. That patients that you're taking care of for that shift. I mean, what else can you say? You're a great nurse. See you next week. Bye.
I wake up every minute with the fever dreams. I push my mind to a limit where it needs to feed. I work blind, got vision I don't need to see. I'm picking mind over matter, I believe in me. I need to find more hours in the day to breathe. Need to find more power in the way I be. And when my mind